Hello, my name is Alencia Sorrendo, and I will be presenting my nursing practicum project on suicide prevention in the acute care mental health setting. My goal for this project is to design, implement, and evaluate an education brochure on suicide prevention in the acute care mental health setting. I chose to do this project because, according to an article by Der Blom et al. 2021, nurses often do not have the necessary resources or support to assess and manage suicide risk effectively. The learning objectives were as follows. The first objective, I analyzed current peer-reviewed literature on suicide prevention in an acute care setting. Next objective, I implemented the new brochure created in the facility for 1 week. Lastly, I evaluated the effectiveness of the education brochure on the nursing staff. Suicide prevention research. First, I reviewed published research for 10 peer-reviewed articles on suicide prevention in the acute care setting. Next, I reviewed the hospital policy on bedside reporting. Then I interviewed a group of staff nurses to collect knowledge regarding suicide prevention in the acute care setting. Lastly, I created a brochure that lists ways to overcome the barriers to suicide prevention. Suicide prevention barriers. I interviewed nurses on the unit to get an idea of what they felt were the barriers inhibiting suicide prevention. The top 4 barriers were lack of training on how to address patients presenting with suicidal ideation, lack of coordination of care between medical professionals, poor screening at different points of care between medical professionals, poor screening at different points of contacts with patients, poor coordination with families and friends leading to the failure to create a safety plan for the patient. Suicide prevention and service training. Based on the peer-reviewed journals and the interviews with the nurses on suicide prevention barriers, I created the suicide prevention brochure. Next, I held staff huddle about introducing the suicide prevention brochure in the acute care facility. Third, I implemented the educational brochure on suicide prevention in the acute care facility on the unit for 1 week. Afterward, I created a survey using SurveyMonkey for the nurses to complete regarding their satisfaction of the information presented in the brochure and in-service that was held. After the survey was completed, I analyzed the data from the survey from nurses. Finally, I wrote a summary of analysis and findings from the project. On this slide, I shared a copy of the brochure that was created based on my research. The top 5 issues addressed were as followed. Empower nurses and other personnel to conduct effective screening. 2. Coordination of care between departments. 3. Involve family and friends in the care process. 4. Use the correct tools to screen patients. And 5. Conduct adequate follow-up for patients. In conclusion, I learned a lot about suicide prevention in the acute care setting. The following were the project's top 3 outcomes. Holding a staff huddle helped me introduce the suicide prevention brochure and educate my team members on ways to help contribute to suicide prevention. The brochure implemented on the unit helped the staff gain a second chance of reviewing the brochure and gain helpful insight to prevent suicides in acute care settings. The data from the analysis of the survey helped to gauge the team's satisfaction with the delivery of the in-service and ways to improve in the future. Thank you.